Anyway, that's one thing. Anyway, excellent talk, Anup. Next is Key to Patient Counseling by Dr. Alex Baby.
At the outset, I would like to thank KSOS and Radharamana sir for giving me this opportunity. And the main objectives of counseling in eye care are to enhance the awareness about the eye disease, to market new services and products, to reach patient expectations, and most importantly, to boost up patient compliance towards surgery or treatment. So I'll be talking about cataract surgery counseling, which is the most commonly done counseling in any hospitals, which is most challenging because of multiple options involved, and if properly done, it is the most rewarding counseling. So the counseling, most important person is the counselor. He should have a basic knowledge about the eye disease, what is cataract, and other systemic disease involved, about the surgeries, the complications risk involved, type of implants, advantages and drawbacks, and costs and benefits. And the counseling should be a good listener. It should be a pleasant person and flexible. It should be empathetic to the patient and non-judgmental, not prejudiced attitude, and tolerant. And most importantly, he or she should have a sound common sense and communication skills. So, who can be counselor? An optometrist can be counselor, ophthalmic nurse can be counselor, or can have a trained counselor who is familiar with optical practice, or a doctor or a surgeon himself or herself can be a counselor. So, whatever said and done, it should be preferably done by a lady because of innate qualities of patients, multitasking abilities, and meticulous setup. So, what are the advantages? Like we have in our hospital, we have an optometrist as a counselor, we have a trained nurse as a counselor, and there are trained counselors who is an MSW. So, like each profession has their own advantage. Optometrist is well versed with refraction, and she knows about she will do a good IOL counseling. She knows the advantages and drawbacks. And about the staff nurse, being a nurse, she knows about the surgery complication risk, and she's more empathetic with the patient. And this pre-op fitness counseling is best done by nurse. And trained counselor, they are trained for the job, so the better communication skills. They are more worried about the economics, and they will try to promote higher packages. And our ideal counselor should have all these qualities, but in practically it is difficult. So regarding the doctor counselor, there are exceptions. I make a very poor counselor. So we have no less patients. We are so egoistic, so difficult. We find it difficult to answer irrelevant and silly questions, which we think silly, not the patient. And we have to face a lot of embarrassing questions regarding cost type, which I found it difficult. And we are too much worried about the complications risk. A patient comes to you, we think about the risk and complications. So outright promises cannot be made. So let them be made by our counselors. So when a patient comes to you, you should be prepared. By the time they come to us, we know, like looking at the records, we know about the details of the patient's type of cataract, whether they have astigmatism, whether they have other ocular diseases, and details about other eye surgery. That's very important because where it is done, and like how is surgery like, and about the drug history and systemic history. And aware about the counseling room, it should be a very cozy place near to the patient waiting area. It should be comfortable. It should be good chairs, and it should be equipped with posters, models, computers, etc. And in our counselor is she's a optometrist. We have an equipment like biometry and keratometry in the counseling room itself, and immediately she will go for this scan, and that makes the counseling easy for her. And whenever we design a room, a hospital, importance should be given to the counseling room. That is very important. And start with a chat. With that, we'll get an idea about the family status, socio-economic status of the patient, and expectations of the patient. So, I want to drive, a 80-year-old person, I want to drive at night. So, you can keep that in mind. And you want to read attitude of the patients, where they are the misers, they are really care about their parents, or they are just, onlookers. And who brought the patient to the patient. So, the patient's father or mother or brother or a relative has undergone a procedure in a hospital, and they are coming to you. That means they are happy patients. So the counseling is easy for you. So how does it start? How do you start the counseling? This is what starts from the basics. The dictum is nail the basics, details later. So even the most educated person, like a professor or a software engineer, he does not know. He may not know what a cataract is. So he is aware about the cataract, but so he should explain the disease with the help of models animations, and you can put a word on the surgery. We are doing phaco. Phaco is something which is a very commonly done case, but it has its own complications, but it is very, it's very less. And you should, this is the time where you have to tell good word about the surgeon. The surgeon is so and so is doing surgery. He has a lot of experience. He has worked there. He was working in Angamali. He was working in the different places. He was trained in such a place. And we have the best equipments with us. We have been operating with maybe the Alcon Centurion in gold. So we have a picture of that mission there and the facilities, etc. And then start talking about IOLs. So first, then you go for IOLs. So every hospital has a long package list. Before the dictum was lesser the number of packages will be easy for the patient, but it is not possible now. The advent of monofocals, trifocals, and UDF and torics, and minimum 12 packages will be there in each and every hospital. That is minimum thing. But in our hospital we have 22 packages, including economy and medicine packages. But we don't show them. We only show this small picture. So the basic IOLs, we talk about the basic IOLs, monofocals, trifocals, UDF, and explain the benefits. We don't talk about toric then see the chart or the record, and if the patient is having astigmatism, then we mention about the toric, then only go for company and cost counseling. So explain about the IOL in detail, which we had done already, and talk about the advantages. Use only positive words, no negativism. All the IOLs in the hospitals are good. They'll give you 6x6 vision, full vision. But if you use this particular type of IOL, vision will be sharper or clearer. Or if you, everything is a safe procedure. If you use a preloaded one, it is more safer. So you should tell like that. And you always use models or computer animations and brochures. And always there is a confusion regarding Indian and important things that we have to clear out, telling that Indian is good, it's always good. But this is the important one, is worldwide people are using that. It's a time tested one, you can tell like that. And irrespective of the socio-economic status, you have to give all the options. So, like what they say, you cannot judge a book by the cover. You cannot judge a person by his appearance. A person may be poor, but he will be willing to pay for his mother or father. But opposite, vice versa is also there. And adamant mentality. So my father has been fixed with this IOL, so I want this IOL. My brother, no, not like that, sir. I know you are like your father is having good vision, but that time this type of IOLs were there. Let's just were not there. You take time to explain about the IOLs even to the most adamant person. Then you go for the cost counseling. Because by the time you have already explained about the benefits, you know about you have an idea about the economic side of the patient and mental side of the bystanders. Then explain the package concept. So a patient, this the surgery cost 30,000 rupees. 30,000 rupees. So no, this is not the cost of the IOL. This is the cost of the procedure. So we do surgery, the surgeon's fees, theatre charges, all this, everything is included. That package concept should be there first. Then you have to make sure that there are no hidden charges. Even the richest person will maybe sometimes irritated if they have some hidden charges or unexplained cost at the end. So after surgery, there will be some charge for the like anesthetic cost, there will be extra, or for medicines you have to pay. Everything should be transparent that time. And if the patient is having an insurance policy, do your maximum to avoid that policy and direct the patient to the insurance officer. That is headache of insurance officer. Counselor cannot do more than that. Then they have chosen a IOL. Make the patient happy and confident about the IOL they have chosen. Otherwise, they will be irritated. They will be confusing, and they will be asking about the IOLs even at the time of surgery. So which is good, which is bad. They will keep on asking. So complications. Some people will ask about complications. There are complications. I think, in my opinion, counselor should avoid the question or passively answer it. And if the patient is they are persistent, send the patient back to the doctor, telling that this patient is having some doubts. I think for clearing the doubts about the complication, doctor is the best person than any counselors. So pre-op counseling, we have to do some pre-counseling in some case. Suppose pre-operative cataract surgery, OCT macula is a common thing which we do for every patient. So a patient is advised for or planned for fixed for a monofocal, trifocal lenses, then patient is having an epiretinal membrane or a macular lesion, then we can tell send the patient to a retina consultant and discuss with the retina consultant and reconsider the choice of yours. Sir, it may not be possible for you. That increases the confidence of the patients in your institution as well as in the counseling. And same with the speedo spectra for all the patients. If there is a correlation, you can tell that you may need viscot and keratometry. Keratometry, so like the initial refraction may not show the correct keratometry. So if you do keratometry and if you find the astigmatism is high, then that is the time you need to recounsel for toric. So medical fitness counseling is one of the most important things. Like repeat medical history and recognition should be asked by every every counselors, and BP and blood sugar should be monitored for every patient who tells, I am okay, I have now the disease. And this helps the counselors should direct the surgeon for giving the referral letters for the right physicians. A patient is a nephrologist and you're giving a referral letter to physician may not help. So, and always, we are all practitioners, always, if a patient is asking for a physician or a suggestion, then you send the patient to a physician or institution who are familiar with you, and we will send the patient back to you. When we said if you send a patient to some hospitals, they will not come back. They will get it operated there also. You should know about that.
Conclude.
Yeah. So one last slide, actually. Okay, sir. So that's not end there. Even during the day of surgery, they have some roles to play. On the day of post-op, so counsel is the most important person. They have to communicate with all these people and keep the counselors happy. You should pay them well, and incentives. I suggest incentives for each counseling, and we should have standby people and keep them happy. And you have to customize your counseling just like you customize other things. Thank you for your patient listening. Thank you so much.
So nice talk by Alex. I am of the opinion that counseling has to be done by the doctor only, because I do it, whatever be the crowd. It's a one-man show for me, but still, because you have a rapport with the patient, by the time you finish, you know everything, as you told, a lot of points. That's true, sir. But I used to feel, because all the medical legal issues and all, would come down a lot, because there's a rapport that it doesn't that easily come. Anyway, that's one point I thought I